I'd also like to talk about corneal biopsy. This is a case of a presented with keratitis. They initially had a scraping and started on broad spectrum antibiotics, but after 2 weeks they weren't responding to the antibiotics. The idea was to stop all the antibiotics, including the antifungals, for a 24-hour washout period. The type of equipment you need for corneal biopsy is a diamond blade. You need a fine tooth forceps like a micro bond, and it's also handy to have a van of scissors available. You need to have your culture media present, so a Saboreau slope, a chocolate slope, and a broth. So after the patient's been anaesthetised with vanoxanate, I put in a wire speculum, and you can do corneal biopsy either at the slit lamp or in theatre. The beauty of the slit lamp is that you can actually use the slit to see what depth of the cornea you're in. So I use a 2mm skin punch biopsy, and you have to be very careful because it's a very sharp instrument. And often with the infiltrates too, you have to be aware of thinned areas, because if you're doing a trephine in a thin area, there is a risk of perforation. So once you've trefined down to adequate depth, you use your diamond blade to slice off the piece of trefined tissue, and this tissue can be then placed directly onto the culture media. The media that I like to use is chocolate slope, which is good for bacteria, a Saboreau slope is good for fungus, and a thioglycolate broth is good for general culture. So after the corneal biopsy has been performed, we can restart the patient on broad spectrum antibiotics, and then once the culture results become available and sensitivities, we can then tailor the antibiotic protocol. If you enjoyed this lecture so far, please subscribe to http://iop.vision. I hope you enjoyed this series as much as we have putting it together. Thank you.